he's one of our graduates of the program. And he's now the chair of the graduate group in demography and the training grant and so forth. He has been a great colleague and a great member of the department and of the demography PhD. So we're very grateful that he's going to share findings from his new research on health and mortality among immigrants in France. So let's welcome him.
Thanks, Emilio. It's fun to be presenting this work in front of our own people. We used to do that, but really we should do it more often. But I'm really happy to be presenting this paper. This paper is part of a larger project on the mortality of immigrants in France and their children. And that was funded by NIH, and I'm going to be focusing on one aspect of this project here. This is a joint project with several people, including Romeo Ganzi here, who is a former GGD student, who now works at the World Bank. So we're working together on this still, and of course Irma Ilo also, who is a co-author on this paper. We're currently revising the paper, and of course feedback is going to be super. Okay. So the title of the paper is Return Migration Selection and its Impact on the Migrant Mortality Advantage. New evidence using French pension data. So why do we care about the mortality of immigrants in general? The proportion of immigrants have increased in many host countries in the past decades. So looking at the mortality of immigrants, it's important because it has implications for healthcare systems, for pensions, implications for policy aiming at reducing health disparities. And if migration status is indeed a variable that has a potential source of vulnerability, it's important to study these potential disparities. Now, in host countries, as many of you are aware of, immigrants actually tend to exhibit lower mortality than natives. This is the so-called migrant mortality advantage, the acronym MMA. It's a pattern that's really pervasive in host countries. It's observed in virtually all host countries. You have the list here. In all these countries, migrants have been observed to be having lower mortality than natives. And that's the case also in France, which will be the focus of this presentation. And this pattern, this migrant mortality advantage, has been qualified as a paradox, as a mortality paradox, because immigrants tend to have lower SES than natives, and since lower SES is associated with higher mortality, we would expect immigrants, in fact, to have higher mortality than natives, but in fact, we're observing exactly the opposite. So four main explanations have been proposed to explain this migrant mortality advantage. The first is so-called healthy migrant effect, or in-migration selection effects, the fact that immigrants are not a random draw from countries of origins. They are selected, and they might be so selected, including with respect to health, that actually, once they end up in the host country, they have better health and lower mortality than natives. The second explanation is the opposite, is return migration selection effects. What happens to those who return to their country of origin? Are they selected as well? And here the idea is that there might be some unhealthy remigration taking place. I'll talk about more about this hypothesis, because this is the main hypothesis that we're looking at in this paper. This is the so-called Salmon bias hypothesis. The third explanation is proposes that this advantage is due to cultural effects related to specific health behaviors or social support. So I think an example that's easy to understand, especially in the European context, where you have a lot of Muslim immigrants. Think about Moroccans that are in Spain, in France, in Belgium, or in Germany. Moroccan immigrants, in part because of religious or cultural factors, are lower levels of alcohol consumption than natives for these reasons. And alcohol consumption is, of course, generating a pretty large burden of disease and mortality in all these countries. So natives actually drink more than these immigrants from these countries, and that actually contributes to lowering the mortality of Moroccan immigrants, for example, compared to natives. And that could explain why they have lower mortality. And then the fourth explanation, of course, as demographers, we cannot ignore that one. Data artifacts can be playing a role, just poor recording of death and populations in these host countries, potentially creating a bias in mortality estimates. Now, the relative contribution of each explanation remains highly debated in the literature. You have a very vast literature that has all these different explanations, and it's tricky in part because of data issues. Okay, so the focus of this paper is on specifically return migration selection effects. So as I just said, it's one of the four major hypotheses in the literature. It's mostly discussed in reference to older ages, to what happens at older ages. And the idea is that at a given age, so controlling for age, you can say, immigrants who are in poor health may be more likely to return to their country of origin than immigrants who are in good health. And if that happens, then this unhealthy remigration generates a downward bias in mortality estimates for immigrants in host countries. The poor health immigrants are leaving more, therefore those who stay tend to have better health, and that could just bias their mortality estimates. So this is related to the concept of informative censoring in life history analysis, event history analysis, and it's a well-known bias when you have informative censoring. Biases hazard rates. And if this takes place, this mechanism may very well contribute or explain the migrant mortality advantage. All right, so the objective of the paper here is to assess the existence of selective return migration, so this sound bias hypothesis, and to assess whether selective return migration may explain the migrant mortality advantage. And here we are using, and that's really the important contribution of this paper here, we're using pension data from France. Pension data is hard to access, but we were able to access pension data. The good thing about pension data, for the purpose of this paper, is that pensioners can take their pensions with them wherever they live. You can work in the US and then decide to retire somewhere else, in Costa Rica, for example, or anywhere in the world. And you're still eligible to get your pension, which means that pension systems like Social Security, they need to track individuals wherever they are. They need to track their pensioners wherever they live in the world, and to track them until they die, and also know when they die so they can stop sending pensions. So it's the best setup you can think of for actually estimating these kinds of effects. Here we're going to be focusing on males age 65 plus. I'll explain a little bit later why we're not using data on females for this paper. Focus males age 65 plus. So before we go into the data, let's look at some background here, and let's look at some of the mechanisms, underlying mechanisms that may explain or not explain negative selection at return. So let's first look at theorized mechanisms in support of negative selection at return. That would explain why there might be negative selection at return. And we can distinguish between direct and indirect effects. So direct effects first, the one thing that in the literature that you find, and it's also documented in surveys, the desire of immigrants to die in one's country of origin. This is a very well commonly formulated desire, and if indeed immigrants have that project in mind, if they suffer some kind of health retaliation, then may speed up their decision to return. Now, negative selection at return may happen if immigrants are seeking family support. which they actually may have in the country of origin, as opposed to the country of residence, the host country. Or they might be interested in seeking more affordable healthcare in the country of origin, and that is particularly applicable to host countries that have non-universal or expensive healthcare systems like the US healthcare coverage, where in fact now when you compare with Mexico, healthcare in Mexico is much more universal than in the US. So you can think of a Mexican immigrant who might experience some kind of severe health deterioration with poor health coverage in the US, and that might actually give this person an incentive to return to Mexico. And of course, when there's a health deterioration for immigrants, especially working age immigrants, this can have impact on their income. And of course, if they suffer this drop in income because of a health deterioration, they're sick, they cannot work anymore, then the incentive to stay is decreases. And that could be also a reason why they just decide to return. Now, negative selection and return could apply also indirectly via socioeconomic status. So even if you don't think about health, but if low SES immigrants are more likely to return to their country of origin than high SES immigrants, then because SES is related to mortality, this could also create some kind of negative selection with respect to health and has an impact indirectly on health. So in the migration literature is this idea, this concept of mistaken migrants, immigrants for whom the migration project didn't work out. The income was not what they expected, they had difficulty adjusting, and for these reasons they decide to return, even if there's no health issue. But because low SES is connected to health, then that creates bias as well. Now, there are actually, you can also think of mechanisms that are actually against this idea that negative selection and return might be taking place. So let's think here also about direct effects. For example, in fact, there might be more accessible and higher quality healthcare in host countries. Think of some European countries where healthcare is universal. An immigrant might have wanted to return, but suddenly there's a health deterioration that's taking place, since as well, I'm not going to have very good healthcare in my country of origin, so actually I'm going to stay where I am. So this would work the other way around. And family support might actually be more readily available in the host country. So same thing. The immigrant has children in the host country, wanted to go back, but because of the health deterioration and the presence of children in the country, in the host country, then the health deterioration might be actually a disincentive to return. And also, there could be some indirect effects via SCS here as well, if in fact may not be the low SES immigrants, but the high SES immigrants who may be more likely to return to their country of origin. And that's the whole concept of thinking of return migrants as successful migrants in the migration literature, with the idea that immigrants might be target earners, and once they reach their target, for example, they want to build a house in their country of origin, once they hit the target, then they return. So, if return migration takes place that way, we should not expect this kind of negative selection with respect to either SES or health. So, as you can see, you have various mechanisms here that are operating potentially in opposite directions. So you can't really tell from the outset, just based on the literature and on theory, in which direction this effect should work. So let's look at what the literature says. There's a pretty extensive literature on this Simon bias, but we mostly find US studies. There are very few studies outside the United States. And what's striking is that this literature really produces really inconsistent results. So there is some indirect evidence in some papers. So there's this famous paper by Abraido Lanza et al. That compared the mortality of Cuban immigrants in the US versus Puerto Rican versus Mexican immigrants, with the expectation that Mexicans are very likely to return, more likely to return than Cubans, for whom return migration may not be feasible. So then it negative health selection is really occurring, you should expect Mexicans to have low mortality and Cubans to have higher mortality in the U.S. because they're not subject to these negative selection forces. Now, when you do these comparisons, you actually find that the data are not supportive of this negative health selection because, in fact, Cubans do have low mortality as well, just as the other groups. So that comparison was not conclusive. Now, there's a study by Alberto Palloni, a famous article in Demography, where they did a binational comparisons of Mexicans in the U.S. versus Mexicans in Mexico that had prior U.S. migration experience, and by this comparison they find some evidence because in fact Mexicans in Mexico with prior U.S. migration experience have worse health than Mexicans in the U.S. Yep.
Not to get you off track, but the Cuban story is so different. I mean, it's very, very highly selective socioeconomically, and the Cuban community in Miami is very, very tight-knit. So I just wonder whether the Mexican-Cuban story is an apples to apples.
Yes, these comparisons, it's very difficult to draw conclusions just by looking at these simple comparisons. Now, if this was a major force explaining the migrant mortality advantage, then you would expect some kind of ranking. But yes, you don't, so which means that there's something else at play for sure. Now, they have some studies that have tried to look at health selection a little bit more directly by looking at health status as a predictor of international remigration. So you look at immigrants in a host country and you measure the health status, and then you follow them and you see who are returning and who are staying. And is health a predictor of returning? And so based on the Mexican Family Life Survey, there is a study here that shows there is some support. But another study that looked at Mexican immigrants who returned to Mexico, this is a study done at the border, actually the U.S.-Mexico border, found no support or even contradicting evidence that it was the healthier ones that were returning. And there's a study in the UK, one of the rare studies outside the United States that showed that there was support for some groups, but the effect is small. But there's one study that really stands out here, and it's a study by our own folks, Cassio Tura, who is a GGD alumni as well, and worked with Irma on a paper that uses also pension data, US social security data, and makes a connection between international migration and subsequent mortality. And that's the only study that we are aware of that really does that in the international context. There's some study looking at internal migration where it's easier to track people, but internationally that was the only study. And they show existence of silent bias for Hispanics. The study is focused on Hispanics, but the effects are not large enough to fully explain the migrant mortality advantage. So the MMA in their study remained after taking selection into account. So what is our contribution here? What do we want to do? The specific contribution is that, first of all, we have a similar setup as the Tura and Ilo study, meaning direct information on remigration and subsequent mortality. But we have, unlike what they had, we actually have individual data, they had aggregate data, and we have a much finer residence follow-up. We're able to track individuals. We have their addresses updated every 3 months, so much finer data. We're working with the European context here with data from France, which is rare in this literature. We also have a wide set of countries of origin of immigrants. That's going to be helpful. We're going to be drawing a lot of information from these different comparisons. Irma and Cassio focused on Hispanics. We have a range of studies of origin. And our contribution, as you'll see, is that we're expanding the concept of the silent bias by providing evidence that, in fact, negative return selection may operate not only at older ages, which is what the literature focuses on, but throughout the entire life course of immigrants. So just briefly here, a little bit of information about the French migration context you may not be all aware of. This is really a short description, just to give you some pointers here. France is considered the oldest country of immigrants in Europe since the mid-19th century. That's the country where immigration started first in Europe. And this is the country that has the largest cumulative number of immigrants. So even though it's not considered a classic country of immigration, it has this kind of unusual status in Europe. And so before World War II, migration flows were mostly from European countries, Italy, Spain, Portugal, Belgium, and Poland. Then after 1945, you have large waves of what we call colonial migrants, mostly from northern Africa. France had a lot of colonies in sub-Saharan Africa, but even more clearly with, tightly I would say, with northern Africa. And so lots of colonial migrants after 1945. Then we have a decrease in labor migration after 1973, not like in the US actually. But immigration continued mostly via family reunification, asylum seeking, and we're also observing an increased diversity of immigrants with new flows from sub-Saharan Africa and Asia. We also see increases in immigration from other EU countries after the creation of the borderless Schengen area in 1995 and the EU expansion in 2004-2007. You can freely move within the Schengen area in Europe, and that led to an increase in proportion of immigrants in the country of France. So today we're talking about 13.8% of France's population that are immigrants. So we're not that far from what we see in the US, 15.3% in the US. Now, in terms of the origins today, I'm looking at the elderly population, which is the focus of this paper. There are two main groups that stand out. Southern Europe first, with 33.7% of the immigrants in that group. So Italy, Portugal, and Spain. And 29.3% from Northern Africa or the Maghreb, Algeria, Morocco, and Tunisia. So if you look at the overall population, then the ranking of these two regions will be different. It depends on the waves and the history of immigration. But actually, for the age group and time frame that we're looking at, the top group is South Europe. But you basically have a third South Europe, a third North Africa, and then the last third is a mix of countries. Yeah.
Can I ask you a quick clarification question? With migrants, you'll only be looking at first generation, right? Like people that are foreign-born. And then, do you know how long this migration advantage does it carry over generations, or how?
So for the second generation,
yeah.
So we have that's another. We have a separate paper on that.
So the literature says that stays more or less.
There is convergence
happening.
There is negative assimilation with respect to health. Now, what we find in the case of France is that for the second generation, there's actually a reversal for the second generation, but not for everybody, for the North Africans. The Southern Europeans actually preserve the advantage. The second generation for children of immigrants from these three countries, but the North Africans actually have excess. Yeah.
And can you say something about access to health care of immigrants in the U.S.? A big part is driven by the undocumented population, not access to health care, they have to go back. Right? So, is there variation among these groups? Is there an undocumented population?
There is an undocumented population, but it's not as large as in the U.S. because there is undocumented immigrants have access to papers and citizenship. So that stock is, that will increase over time. And everybody has access to free healthcare, minimum basic healthcare, even if you are undocumented. This is a program that covers everybody, even if you have no income or no documents. So that's going to be an important factor to think of. Now, of course, if you're doing about better coverage than today, and less likely to work. It's more advanced healthcare. The basic healthcare is eligible. Okay, so let's look at the data. So we're looking at data from France's largest pension system is called CNAM, and what CNAV does with this pension system, there are several pension systems in France, but CNAV is the largest one. It covers all individuals who are employed in the private sector in France at some point during their career. So you might think, well, how about civil servants? How about self-employed individuals? Lots of different, not everybody are employed in the private sector. Well, the good thing about this database is that as long as you have at some point in your life worked in the private sector as a salaried employee, then you are in this database. And it's very rare to spend your whole life without having never had a summer job or being employed in the private sector, a short-term contract at some point. So even civil servants in France, and there are a lot of civil servants in France, they typically at some point early in their career, they are actually employed on a private law contract and then they contribute to the system. So we have everybody who have at some point, even if it's a short amount of time, have contributed to that system. And that covers, it's been shown that when you look at the male population, it actually covers 95% of the male population age 65 plus. So 95% of males age 65 plus in France are present in this CNAV database. It's not so much the case for females and especially immigrant women who have not worked as much and who sometimes derive their pensions indirectly through their husband. So the proportions are low for certain individuals. It goes down to 65, 60%, which is why for this paper we are focusing on males because it's much greater coverage. So we think that we can generalize the results much more. So the data specifically, it's a random sample of individuals aged 65 plus who were alive as of January 1st, 2009 and receiving a pension from CNAV at that point. So they are pensioners at the time when we start observing at age 65 plus. So, and they may reside, at the time when we start observing them, they may reside in France or abroad at baseline. Because again, you can take your pension with you anywhere. So we're just looking at all these pensioners, they're receiving a pension from this pension system, and they can be either in France or abroad. We know that they all lived in France at some point because they contributed to the system, but by the time they retire, they may be still in France or abroad. Our sample size is, this sample was actually, they prepared the sample for us, so we were able to ask them what we wanted in some way, so we always, after the fact, we actually asked them what we but we oversampled, because of the study, the purpose of the study, we oversampled foreign born pensioners. So we have about 160,000 foreign born pensioners in 2008, so that's not what was represented. We have an oversampling of foreign born. Yep.
Is it pretty easy to get a pension to, like, you move to the Canary Islands or wherever, to get it? Because like in the U.S., if you want your Social Security, if you live overseas, they make it a huge hassle. You have to go to the embassy and fill out another thing.
Yeah, we'll talk about that too. Yeah, you need to prove that you're alive.
Yeah.
So that's, I'll talk about that, yeah. So we have residence and mortality follow-up for 4 years, from January 1st, 2009 until December 31st, 2012. All right, here's the answer to your question. So how do you track survivorship among pensioners residing abroad? For those who live in France, there's nothing to do, it's automatic. Death information is automatically integrated in the database. So as soon as there's a death happening, there's this gigantic database of national identities in France, and it's updated every day. So as soon as the person died, that information is connected with the pension system, and the pension payment stops. Okay. So that's good. But for death occurring abroad, there's no such automatic integration, except for some pensioners residing in some EU countries. So now there's some data sharing agreements that are happening. So if you're a pensioner, a French pensioner residing in Belgium, then a death in Belgium will actually give the information to France so that the pension will stop being paid. But that's only with a few countries. For those outside who do not have these data sharing agreements, then the survivors, the family, they need to provide a local death certificate. And you can think, well, this is probably not thorough enough, and that's what the pension system believes, that it's not thorough enough. So, because you can have fraud, and people are just, they have an incentive not to declare the death of the pensioner. So, to attenuate this potential fraud, the NAV asks, that's true for the Social Security system, they ask pensioners who reside abroad to provide a certificate of existence annually in order to prove that they're still alive and to continue receiving their pension. And if they stop providing that certificate of existence, then the pension system will assume that they died and will stop paying the pension. Now the pensioner might say, oh no, I just forgot and all that. So there's a procedure for still proving you are alive. But in fact, the overall the pension system considers that these individuals who stop providing these certificates of life that they are assumed dead. So we're going to be using this feature here for tracking our data. We're going to be adjusting death abroad when pensioners stop producing certificates of life. So we're doing pretty much like what the pension system does, with some. We're being pretty conservative. We'll talk about that.
So, suppose somebody has to report every January that they exist, and then they die in March, and until the next January, the relatives can be receiving.
I mean, if the relatives provide a death certificate, and sometimes you need to show a death certificate for other reasons, then they will stop, they will stop the pension earlier. But in fact, if it's just a gap, yes, there will be a little bit more pension than you should be eligible to provide. So so with this information, we have this database where each pensioner is going to fall into one of 8 categories, depending on their residence and how their residence and survival status change. So the first 4, so these are the lifelines for individuals. The top 4 individuals are pensioners who reside in France at baseline, and we observe them. And then they be tracked. The first one just survives the whole period. The second one dies, in France still. So solid lying, residing in France. Then individual number 3 here out-migrated during the observation period, left France. And then of particular interest is individual number 4 who out-migrated and then died after out-migration during the observation period. And then we have the bottom 4 individuals. These individuals are pensioners from the CNAF system. We know that they worked in France at some point, but by the time we start observing them, they're already abroad. They have returned abroad already. And we track them as well. And they might survive or die. These last 2 cases are very unusual cases, so individuals will return in France during the observation period. They're very rare cases, but it can happen. Someone who resides abroad returns to France from the observation period and survives. Yeah.
How long do you have to work in the private system to get a pension?
That's a very good question. It's not like the US where you have Social Security. I think it's 10 years to be eligible for a pension. There are no minimum duration here. You are eligible for a very small pension, or you are eligible for a pension as soon as you contribute at some point.
And if you leave, and it's just like too difficult to keep with the bureaucracy, and you don't receive the pension, you're not in the data, right?
Yeah. So we'll talk about these issues. There still can be some selection here happening. All right. We have 2 different approaches for assessing return migration selection and its effect on mortality. Approach number 1 is a prospective approach. We're looking at the top 4 lines here, and we're tracking people. Because for them, the good thing is that we can time departure from France very neatly and then have a mortality afterwards. So we're just doing a survival analysis with predicting death, and out-migration is going to be a time-varying variable, and can see it's associated if out-migration is associated with higher mortality. The out-migration is a time-varying variable. We think that this is the best setup for identifying negative selection effects due to the short time window between remigration and subsequent mortality. There always is the danger, and we'll talk about that here, that what happens afterwards if they out-migrate to countries with worse conditions, that this could affect what happens after out-migration. So we want to limit the time period as much as possible. I think we have only these 4 years, and we think that puts us in the best position for identifying negative selection effects. Now, the disadvantage of this approach is that it ignores the large share of foreign-born pensioners who remigrated at younger ages and who may also have been negatively selected. So the bottom 4. Out-migration doesn't only take place at the time, that takes place throughout the life course. In fact, the vast majority of return migrants, they return at rather midlife, 40, 45. There's lots of migrants who do not have spend their entire life in the host country. And we want to know what's happening with them. They might be also subjected by negative return selection. So, and that's a disadvantage of this first approach. So this is why we're also using a second approach where we're looking at all the foreign-born pensioners, regardless of where they reside at baseline. We're looking at all this sample, and we're comparing mortality abroad versus mortality in France for these immigrants. We're comparing the mortality among the foreign-born pensioners residing abroad versus in France. Is residing abroad associated with higher mortality than residing in France? The advantage is that it takes into account this large share, as we will see, of foreign-born pensioners remigrated at younger ages. The disadvantage is that then selection effects are going to be more difficult to isolate due to the confounding effects of post-migration conditions in the country of origin. They return earlier, they have a longer time exposure in the country of origin, and that is going to be confounding our results. So the idea is to have these two approaches. They both have pros and cons, and to try to get as rich a picture as we can. And then we're going to be looking at whether return selection may explain the migrant mortality advantage. And for this, we're going to be a comparison of the mortality of foreign-born versus native-born in France, just to assess the scale of the migrant mortality advantage. So we're looking only at those residing in France, and we're comparing migrants versus natives. And then we do a second model where we include those who have left. We sort of repatriate them, and we take into account the mortality, and we see how does that impact the advantage. So that's our approach.
To clarify, so you only look at those who return to their home country, or you look at those who would go to another country?
So that's a very good question. We, from the standpoint of bias, it doesn't matter where they go. If they go anywhere, I mean, if they leave the country, they're lost to follow up, and that can affect what you observe in the host country, regardless of where they go. But the theory is more about returning to country of origin, those mechanisms that we talked about. It turns out, and I have a slide on that, and it shows how you can look at it. It's like 90% of immigrants who remigrate, they remigrate to their country of origin, overwhelmingly. So out-migration and return migration in this data is actually pretty much the same thing. But we have this distinction, and we have a sensitivity analysis where we limit to those who return to their country of origin versus all of them. All right, this is our sample very quickly for this approach number 1. These are the lines 1 to 4, the top lines. So we have 83,000 foreign-born who are residing in France at baseline, and out of them, 15% die in France during the observation period. So that's the first thing. And then out of these 83,000 people, during the observation period, follow-up period, 2,000, etc., out-migrate. That's 3% of the sample. 3% of these immigrants, of the regions, these pensioners, leave France during the time period. And out of these people who returned, 437 died during the observation period. So that's 18% of those who returned. 18% of those who returned died. That's not a huge sample, but that's going to be what we're going to be working with. And you can see here the breakdown of countries of origin, the emerging regions, try to get a greater sample. Obviously, the South Europe and North Africa are going to be the places that we're going to be best able to greater sample sizes. So let's first look at the effect of out-migration on mortality with this prospective approach. So here we're looking at the hazard ratio of mortality ratio of those who left versus those who remained. So that's with this prospective approach. This is the effect of out-migration on mortality, with the reference period separated for each group being remained in France. And what's pretty striking here is that, leaving France is associated with excess mortality during this short period of time. The mortality hazard ratio is 2.4, so comparing those who stayed versus those who left. Okay, this is the coefficient associated with this time-varying variable for out-migration. That variable switches to 1 once the individual leaves France. And it's high. It's high, and it's also very consistent across countries. Yeah.
Are you going to show us the actual hazard graphs? I'm curious if it's fast, like if people anticipate they're going to die.
That's just,
yeah. Host country, or is this really, or is it kicking in?
So that's the proportional hazard model. So that's the coefficient associated with leaving France. We're now distinguishing depending on how much time after we don't have a lot of follow-up here. So
Sure.
I think it's not a huge sample, but overall, leaving the host country is associated with pretty striking excess mortality. And I think what's interesting also is that it's very consistent across countries of origin. So it doesn't really matter if you are going to, if you are Italian or, Portuguese, if you're returning to these countries or if you're returning to Northern Africa, it's really consistent. There is excess mortality associated with these departures, wherever they're from and wherever they go. Yeah?
So I guess something interesting is that if you leave at age 66, it's kind of the same as if you leave at age 80.
It's a proportional hazard model.
Yeah. And so do you have a sense of when people are leaving after age 65?
So they tend to, when they leave, they tend to leave rather on the earlier range of the age group. So the more they age, the less likely they are to leave. So that's an average for the entire. We're working with 437 deaths. So making these further disaggregations is going to be tough. But we have all the information to see. Okay, so we know that those who leave have higher mortality than those who stay. What is the impact on the migrant mortality advantage with this first approach? So here in this first comparison here we are comparing, so only those who reside in France. This is just classic health disparity study of looking, we have people in France, maybe foreign born, maybe poor, and we're comparing these different groups. The reference group here are natives. We are documenting here the migrant mortality advantage. Foreign born individuals at these ages, so 65 plus here, have lower mortality than natives. It's significant, it's not huge. It would be bigger if you were looking at adult ages, mid ages, but at older ages we know that there's a bit of convergence, but we're still picking it up here. And it's important because we're having very thorough longitudinal data here. We're not depending on census data, or this is thorough. So we're documenting the migrant mortality. It varies depending on the countries of origin. The Northern Africans here have a greater advantage relative to the natives. But in Southern Europe, the Portuguese stand out as having a pretty strong migrant mortality advantage here. So what happens to this migrant mortality advantage